be
hold on.
tested on
Let's all
blood
get ready.
vessels that we can see. So,
Oh, sorry. It's okay.
starting over here, we can see the arch of the aorta. We know it's going to go down this way, so blood is going to go in this fashion. First branch, brachiocephalic, then the left common carotid and the left subclavian. The brachiocephalic we know is going to give off branches which are the right common carotid and the right subclavian, but we can't see it on this model. So we can take a better look at this model. This would be the brachiocephalic, and as the brachiocephalic comes off, it gives off two branches, one to the right common carotid and one to the right subclavian. As the name common implies, there's going to be two branches. The common carotid bifurcates here. In this case, it is the left common carotid into the external carotid and the internal carotid. External going to go to the face, internal going to go to the brain. And let's see, as we come down off of the aorta, continuing our journey along the aorta, we have the intercostal arteries in the descending portion of the aorta called the thoracic aorta. The diaphragm marks the demarcation between thoracic aorta and abdominal aorta. And the first branch coming off of the abdominal aorta is the phrenic, the inferior phrenic artery. The next branch would be the celiac trunk, and it's a very short little piece of blood vessel right in here, and it gives off three branches: the common hepatic, the left gastric, and the splenic. Common hepatic, the left gastric, and the splenic. Next branch is the superior mesenteric going to the greater omentum. Then we have the renals, which we see here, and the adrenal or suprarenal, but we do not see one on this side. It's there, it's just not visualized. We go from there to the gonadals. Again, we don't see them very well on this model. We come back to this model, and we see our gonadal artery coming off this way. Finally, we have the inferior mesenteric going to the lesser omentum. The aorta ends at a very large bifurcation, the common iliacs. Once again, as the name implies common, they're going to give branches sooner or later, and they're going to be named iliacs again. And we have the right internal iliac and the right external iliac, and the left internal iliac and the left external iliac. The external iliacs are going to pass under the inguinal ligament, and when they do, they become the femoral artery.
Yay, Dr. Keegan!